The following views expressed on this program are not necessarily those of CNS Channel 6. Good day to you, Guyana, and welcome to another edition of Facing the Nation. I am Malika Ramsey. Thank you so very much for joining us this week. Well, we have a little change this week, a little surprise for you, and I'm calling it a surprise because I usually tell you what's coming up, and I didn't tell you about this last week, but it is something that is very informative, very helpful, and it will contribute to every single citizen once you put yourself in a position whereby you can benefit, and it has to do with the health sector. It is my pleasure to welcome to Facing the Nation today Miss Dinte Conway. She is from the Food Policy Department, Ministry of Public Health, and of course Mr. Nazim Hussain. He is from the National AIDS Program Secretariat, NAPS. They're both going to be talking about the Health Expo that's coming up soon. However, they're going to be focusing on the departments which they are representing today. In the weeks to come, right before the actual event of itself, we'll try to have some other persons coming on to talk about their contribution and so on. Ladies and gentlemen, welcome to Facing the Nation.
Thank you very much.
Thank you.
All right, great. First of all, Dinte, I'm not sure if I got that right. Food policy, as in Food Policy Department.
Food Policy Division.
Division. Yes. Okay. First off, again, they're not here to talk about every single thing about the Health Expo, but let's talk about the when first, and how our plans and so on coming. Dinte, we can start with you.
Thank you so much. From our department's point of view, we're very, very excited to be part of this Health Expo. Mm-hmm. It will be launched on the 30th of May.
Okay.
And it will be for 4 days up to the 2nd of June. 4 days. A lot of hours for the public. For instance, the opening ceremony will be at 5 p.m., but it goes all the way until 10 p.m.
And that's where?
And that is Sophia Exhibition Center.
Okay.
And on a Thursday, it opens from around 3 p.m. to 10 p.m. So we're catering for workers and school children, so when they leave their jobs, they can come. Friday, strictly catering for school children a lot, from 10 a.m. and we go all the way to 10 p.m. And then Saturday we have the closing that goes up to 10, but it starts in the afternoon too.
Why is this important, why is it important for the public to get involved, especially coming from Food Policy Division?
So for Food Policy Division, a lot of our work has to do with nutrition education, all right? And this expo, it's really, really in sync with what we do. We do a lot of outreach activities, we do a lot of health center counseling and so. But this here would be in line with reaching the people from the communities, wherever you are, who is going to come to the fair and get our service. At the Health Expo, we'll be launching our food-based dietary guidelines that we've been working on for about 3 years now. We've revised it. It took a lot of work, so we're using this opportunity to launch it. The food-based dietary guidelines for Guyana, there are 9 guidelines. It sounds like a lot, but each guideline would have specific, simple messages that people can work with. for healthy eating and physical activity.
I'm happy that you talked about healthy eating and physical activity, because it's wonderful. I mean, sometimes if you pass, let's say, by the seawall area about 5 in the afternoon, you would see people exercising, and you hear people have become more conscious about their health and what we put in our bodies and so on. Can you say if at the expo you will have people on hand to answer, possible questions?
We will have people on hand to answer all your questions about exercise, about what to eat, what not to eat. Sometimes it's not really not to eat, but in moderation, because we can't really take things out of your diet, right? It's reality. We like to eat things that not necessarily good for us.
It tastes good.
It's attractive, and we're attracted by scents and so. So we just want to work with people to tell them moderation, and there are some things definitely that you should be staying away from, right? Like sugary beverages and so, because the content of that what it has. But we also promote a lot moderation.
One other thing before we talk with Nazim, do you find, and this is even before this health expo, that it's a case where people have gotten so conscious that even without a health expo, they're reaching out to find out what I should eat, what in moderation, if I should change my lifestyle, if it's necessary, if it's not necessary?
Yes, a lot of people, especially at the health center setting where we have nutritionists stationed, we have a lot of clients coming to us to find out every day, things are influencing us every day. Sometimes we want to do what is right, but there have various factors that influence us. And a television ad, for instance, sometimes you're at a meeting all day. You don't have a chance to go and eat what you would have prepared, perhaps from home. You're giving something maybe at the meeting that not necessarily you would want to eat, and the amount too. So various things would influence us. And we're there to help you, to overcome those urges sometimes, give you options that you can use that are good for you and that are filling and things like that.
Okay, all right, great. Let's talk about NAPS. NAPS involvement in all of this. Again, viewers, even though Nazim is not here to talk about HIV and AIDS policy and so forth, as you know, NAPS is the National AIDS Program Secretariat. Nazim, how important is the role of NAPS in this health expo? Especially, I haven't done the full research, but a few months ago we heard that cases of HIV and AIDS in Guyana we would have seen a little increase for a period of time. Against that backdrop, how important is NAP's contribution?
Before I answer that question, I'm going to give a little rant here.
Sure.
But before, and if I forgot, you would ask me another question. You see, the name of your program is Facing the Nation.
Yes.
And when you look at every year's the national budget, the health sector bill is huge.
Yeah.
Why? Because a lot of us get sick because of things we do, and then we turn up at all our hospitals to get care and treatment. Yes, our government need to care and treat, but then do we look at that big health bill? And that health bill is not healthy. That's a burden to the taxpayers and so forth. So the expo is really to sensitize Guyanese on the whole. Hey man, you need to adapt different lifestyles, eat well, exercise, stay away from drugs and alcohol so you can live better. So then the minister, at least I don't know some of the other ministries, our ministry can have our budget going down because we won't need enough money to take care of plenty sick people. I don't think
prevention is better than cure.
Prevention is absolutely better than cure. And I think against that backdrop, we're having this health expo.
Perfect.
To let guys know that it's onus upon you. What we're doing here is really targeting nation building. Because if we have sick people, who's going to build a nation?
Agreed. Yes.
And so that's what it's all about. And I know the honorable minister is. I hope that she will make this an annual feature.
This is the first.
First of its kind.
Of its
I
kind.
don't think
Even though
It may not be a first fear, but the first
like this
expo, but it's the first. Okay.
It's the first health expo.
It's the first health expo.
Okay.
We have had health things all over the place. Health fair, you were using.
Yes, I was.
And I'm upset about it. But it's an expo, really, selling the nation's to the nation. But now to your question about HIV and AIDS.
Yeah. How important is that?
It is, and that too. When you look at lots of money we have to pay to really run the AIDS program from care, treatment, and prevention, it's quite a lot. So, based upon that, we wanted to sensitize Guyanese people. We want to sensitize Guyanese people to take good care of themselves so as not to contract HIV and AIDS and having to go through the whole treatment regimen.
All right.
As the case may be.
Sorry to interject, Nazim. Viewers, we're going to take a very brief, a few seconds break. We're going to sort out the technical difficulty and be right back with you. Stay tuned. This is Facing the Nation. Thanks for staying with Facing the Nation. Of course, we're back here with Miss Dinte Conway and Nazim Hussain. They're both talking about the fear. Back to what you were saying, Mr. Hussain, about NAPS, the importance of the involvement of NAPS.
So what we'll be doing at the Health Expo is, again, just like food policy, we too will go on outreaches to go into communities to sensitize people about HIV and AIDS and the way how they can prevent themselves. We do VCT testing, voluntary counselor tests, that type of service. So at the Health Expo, we will have 2 booths set up to testing. And then we'll have another one, which we will be engaging members of the public with information sharing. We have some giveaways just to grab people. So I think there will be lots of giveaways for people to come, to woo people to come to the expo. You can't come to something like this and don't have little tokens to take away. And so, but you have to earn your gifts.
You have to earn
So we'll be asking questions, we'll be giving information. Even people who don't want to be tested for HIV, we can still counsel them and give them referrals and these things. And I'm quite sure other areas that have linkages to HIV, domestic violence, mental health, and so forth. All of those things, if we don't do it at our booth, the whole health system will be there in those days that Ms. Conway mentioned. But basically what we'll be doing is testing and education.
Okay. I'm happy about that, and I'm just going to put you on the spot a little here. It's not.
I know you did ask about what's happening with the HIV world.
Exactly, but I don't. Again, viewers, he's not here to discuss policy, so to speak. But how much can you say about really and truly what is happening with that world, and why has it? And again, I'm asking him as Nazim Hussain.
Right.
Why do you think we've gone into a mode where? Let me use the words of a colleague of mine. She said to me, you know what? When we were teenagers and younger than teenagers, we were afraid of the HIV and AIDS pandemic. Now it seems that the younger
social
people
media is
are
here.
fearless. But
when you were a teenager, there wasn't social media. People are now linked, and people are not linked via this, but now they want to link together, and it's a natural thing. And whatever young people do, that's what they will do. But how do we educate them? And and for us to educate them, we might be wanting to cross certain barriers that some people might frown upon. But somehow we have to do that. But when you look at what is happening in the newspapers, and I'm quite sure Ms. Conway can attest to it, teenage pregnancy. I mean, you don't get pregnant just like that. It means there's a lot of unprotected sex happening.
Yeah.
And we need to talk to our children. I always say, you know, we send our children to school to become lawyers, doctors, politicians, scientists, and then we are surprised that they beat their wives when they grow big. Nobody to talk to our children about that aspect. When you leave school, this is going to happen. And they're forming relationships in school. And that's what we find the younger folks now, it's a bit worrying that we find the younger folks are now becoming infected. Not that it's escalating, but it's, you know, we did well. Guyana was number 2 once in the Caribbean. Now they don't even mention Guyana because we're not in the top 5 in terms of HIV prevalence. So we have done good. But the thing is, it's creeping up back. And the thing is, there's linkages. For you to, even if you're not HIV positive, you have to eat well and exercise. And when you're HIV positive, your doctor will tell you, you have to eat good, exercise, stay away from drugs, stay away from alcohol, and these things. And I think that's the message we want to send to Guyanese come this month end, is that, as Ms. Conway said, we don't want to stop you from eating anything. Eat, but in moderation. I'm quite sure people are going to jump down on my throat and say, well, what, you know, we break up all the rum shops and all sort of things. No, the rum shops might be there, but how do we monitor it? Because from the rum shops, that's how you get people in accidents.
And go home and fight with their spouses.
Right. And that's domestic violence, and then end up in the hospital. And we need beds for that. And so we don't, and all these cars are coming in, lots of accidents. We need to buy more beds. But that's, again, I started off with talking about the budget.
The budget,
so
yes.
the more we self-inflict on us, the minister has to justify why she wants X amount of money in the national budget.
Nazim, even before I begin to wrap, because I'm going to try to get some more sentiments from Ms. Conway, in saying that, and this is back to the HIV and AIDS pandemic, yes, in saying that it is creeping up back, is it also fair to say that it may have to do with funds, but is it fair to say that we as a country, we have stopped or reduced campaigning against it?
You asked a very good question. And sometimes I think it's an unfair question. What happened is what people are saying, there's no buzz on HIV. And you mentioned funding, and funding shouldn't really be an issue because we know the funding would have started to decline, and systems were put in place for a transition. And the government has done pretty well. Government has done pretty well. I am part of transition. I was being paid under donor money. 2013, I became the first set of people who were paid with donor money transition into government. A lot of us stay on, a lot of us move on because they didn't like the government salary. Well, I have no choice. It's something, it's a passion I have. I don't also work. I get my pay from government, but also I have my volunteer work with artists in direct support, and that is because when you have a passion for something, it's in your blood, and you know. But there's going to be those of us, personally, as Nazim, Hussain, would like to see government and other agencies really put back youth on the table. Those are and same thing. We have to start with the youths. Talking about food, and I think there's an unofficial thing with soft drink and sugary drinks at the ministry, right? I don't think you might be finding sugary stuff at the Health Expo.
Oh, you wouldn't?
No. So we all of our vendors know that we are not having any soft drinks, any juices, carbonated beverages, tin juices, bulk juices, because even though it has some of them are fresh, fruit juices, which has vitamins and so, but the added sugar that it has, it's tremendously high, and especially for our children. Like one can of juice, for instance, would have the total amount of sugar that one person should have for the entire day, and that's just in a juice. So you drink that juice, you drink your sugar maybe in your coffee or your tea, and some of us put sugars in our foods, our pumpkins and things like that, and so it adds up. So at the end of the day, you find that you've had probably a whole bowl of sugar added that you didn't even know because it's hidden in a way, right? And you wouldn't literally sit down and eat a bowl of sugar just like that.
Indeed.
Right?
Indeed.
So we wouldn't have that. We'd having water, coconut water. Even the vendors would be having healthy foods, grill and broil and baked and so, no fried, nothing fried. So it would be very, very interesting to see people's response. And I'm sure a lot of things taste good, but it's just for you to try it. For instance, our booths, we would be having practical demonstrations to show you that
how to prepare.
Exactly. For instance, an egg ball doesn't have to be fried. You can bake your egg ball, and it will have very, very similar taste to the ones that are fried, and you still have the same kind of effect.
What was it, Jenny Partner come up with a callaloo drink?
We have callaloo drink, we have black eyed peas, buns.
You're going to go
Yes,
come get your, bring
some of them are acquired taste,
that guy
but
should
we
get
have
callaloo
acquired
drink.
our taste. We have acquired our taste since we were babies, but whatever our parents give us after breastfeeding is what we've acquired. So acquiring a taste is,
It's
it's
not very difficult.
No, not very difficult. We just have to focus on that.
Great.
We should can callaloo drink in this country.
I want to tell Nazim he's going too far, I'm still not sold on it yet. But, ladies and gentlemen, before we wrap up, just remind the viewers the when, the where, and if there's anything that I missed that you'd like to put in at this point regarding the Health Expo 2018.
Well, Ms. Conway, it's going to be from the 29th or the 30th?
The 30th of May to the 2nd of
To
June.
the 2nd of June at the Sapphire Exhibition Center. On Fridays, for me, it's going to be an exciting day when we're going to be targeting the children, school children.
Okay.
Obviously, we'll be doing that in collaboration with the Ministry of Education. And that I look forward to because that's our target. That's the people, and that's going to be the revolutionary day, particularly the health revolution. And basically, yes, as I said, to help reduce the burden, the health burden, the budget of our country. And we're inviting all Guyanese to come participate. It's not only going to be a look. People will participate. At the NAPS booth, you will have question and answers on what you know about HIV and AIDS. People will be invited to take a test. Even people who are HIV positive can still come and get more information. Yeah.
Okay. All right, great.
And just to add
Go
to
ahead,
the
sure.
entry is free.
Yeah.
There's no payment, and the services offered are free. So we want everyone to come out
come and be a
and make the
part.
best use because I don't know much about, I can't say much about all of the departments, but we have dental, we have blood pressure, blood sugar, all of those services that you would have to go and pay for, they're all free at the Health Expo for all of the days.
Great. Thank you so very much, ladies and gentlemen. Viewers, if you're now joining and you've missed this conversation, what was happening, the two guests were giving information about the Health Expo that is coming up is going to be launched on the 30th of May. Those of you who follow me on social media, before the end of the day, I'll try to have this both on YouTube and Facebook pages so you can help, and you'll be helping the Ministry of Public Health spread the information. Again, this is important for every citizen to come on board and be a part of. Again, this would have been a conversation with Ms. Dinte Conway of the Food Policy Division, Ministry of Public Health, and of course Mr. Nazim Hussain of the National AIDS Program Secretariat, NAPS. Coming up on the other side, we'll be focusing on that conversation I had last Saturday with the head of the Civil Defense Commission regarding those preparations for potential oil spills and so on. As you know, we keep talking about moving toward this oil economy, so it is important for you also to get that information. This is Facing the Nation. Stay tuned.